This episode of Intelligent Medicine is brought to you by the Fresh Pressed Olive Oil Club. Did you know that olive oil is at its peak of flavor and nutrition right after it's fresh pressed at harvest time? That's why my favorite olive oil is delivered to me direct from the latest harvest, thanks to the Fresh Pressed Olive Oil Club. And now you can try a bottle yourself, normally $39, for just $1, with no obligation to buy anything else. Visit myfavoriteoliveoil.com. In my case, it truly is myfavoriteoliveoil.com. myfavoriteoliveoil.com. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman, and first of all, forgive me if my voice sounds a little froggy. I just returned from a quick trip to Belgium, a 4-day weekend, compressed in time, lots of loud disco music at a wedding, and trying to talk over the disco music and the cabin air, between the cabin air in the plane and the disco music and the yelling. My voice is kind of shot, but that's okay because today we have a capable guest who will probably do most of the talking. Our subject relates to a new fascinating paradigm in medicine. Integrative medicine, as most of you listeners know, seeks to find answers for patients with complex problems that have eluded the diagnosis and treatment of many conventional doctors. And so today we're going to talk to an expert clinician who is going to tell us about histamine intolerance, sometimes referred to as Mast Cell Activation Syndrome. It's a great new way of thinking about patients who are complex, who seem to have a myriad of symptoms. Some of them seem to be diet-related, but it's unclear that they have specific allergies to one or two things. They may respond a little bit to reduction in gluten or dairy intake, but it doesn't do the job. And so we're looking for another handle on the problem. Dr. Dempsey received her MD from the Johns Hopkins University School of Medicine and her BS degree from Cornell University. And she completed her residency at NYU Medical Center Bellevue Hospital, which is something that we have in common. Dr. Dempsey, did they still have rats in the on-call room? I remember that when I tried to catch an hour or two of sleep, I heard these scurrying of these little tiny feet below me. But I was so tired.
I think I missed out. I think I missed out on those.
I was before your time. I think they probably addressed that problem after you were there. She then served as an attending physician at a large multi-specialty medical practice in White Plains, New York, before opening Armonk Integrative Medicine. Now, you have to be smart to have a practice in Armonk because that's the headquarters of IBM. So there's a lot of smart people. Dr. Dempsey combines primary care treatment there and integrative medicine with particular focus on thyroid problems, autoimmune disease, hormonal imbalances, vitamin deficiencies, food sensitivities, and weight management. And she is an active staff member of Greenwich Hospital in Greenwich, Connecticut. And she's a member of the Institute for Functional Medicine and the American College of Physicians. And she also teaches doctors, which is extraordinary attribute because she explains complex issues to other doctors so that doctors can then bring her knowledge to the fore in treating their patients. So it's a pleasure having you on Intelligent Medicine, Dr. Dempsey. Welcome.
Thank you so much, Dr. Hoffman. I'm happy to be here.
Okay, so first of all, frame the issue for us because in your lectures you refer to it as Mast Cell Activation Syndrome. MCAS, and we call it MCAS, but in the popular parlance, and this is sort of making the rounds a little bit in, on Facebook and in social media and on the internet, it's referred to as histamine intolerance. Are they one and the same?
I think that histamine intolerance is probably a simplification of the issue, but it's easy to understand in that way. And so I'm okay with calling it histamine intolerance. I think when you refer to it as mast cell activation, you're really looking at the root of the histamine intolerance. So I do think that they are related. I think there are a subset of people who probably have some level of histamine intolerance and don't have mast cell activation. But I think for the most part, you can generalize it like that.
Okay. So what are we talking about here? Give us, example of the range of symptoms or conditions that can be attributable to this.
Yeah. So, I'd like to just go back a little bit just to kind of give people a framework with which to look at this. I take care of a lot of complex chronically ill patients, as most doctors do if they're doing integrative medicine. And it became very clear that there are these patients that they're very hard to really identify and unifying diagnosis. They have a lot of different things going on, and you can't always unify, but sometimes you can, and you always want to get to the root cause. And so what I found was that there was this syndrome that was being described more and more that I think really explained a lot of my patients' issues. And that's this syndrome of mast cell activation. So the thing about mast cells, and just to give the background, mast cells are actually white blood cells. And they are our defense mechanism. As all white blood cells are, they help us fight things that are bad for us, that are foreign to us. Mast cells in particular are meant to attack whatever is bad. So initially, or way back when, even when I was in medical school and maybe when you were being trained, we always thought of mast cells as our line of defense for allergy. And that's how we started to get to know these cells. Mast cells were what would happen, mast cells would respond to the environment. So if you, let's say, are allergic to pollen, we knew that mast cells would see the pollen as foreign and mount an attack on the pollen and would release histamine, which is found within itself. So these mast cells contain these granules, we call them, of histamine. And when it would see pollen, it would explode, release histamine. And histamine is really inflammatory. It causes blood vessels to dilate, to expand, to leak fluid. And so when you, let's say, are allergic to pollen and you would release histamine, you would get the classic allergic type symptoms, which are the runny nose and the itchy eyes and all the things that are, again, thought of as allergy. And so for a while we kind of knew it as that and really thought that mast cells were really just our allergy defense. Now, it's a defense mechanism, but it really backfires on us because in exploding and releasing these histamines, it's meant to kill whatever's foreign. So it's reading pollen as bad and it's trying to kill the pollen, but in essence, it's actually killing us or it's attacking us because the histamine is actually bad for our own cells.
The analogy might be, if you use a high-powered fire extinguisher to put out the fire, okay, you may extinguish the fire, but you may have some collateral damage. Exactly.
I like that analogy a lot. And so, but again, within that context, it was sort of isolated to just allergy. And then we started understanding through research that mast cells actually are our line of defense for just about anything. Bacteria, parasites, viruses, fungus, it reacts. It's really trying to protect us from those things. And it will essentially do the same thing. It will release histamine and a variety of other, we call them mediators, things that are found within the mast cell. And those mediators are supposed to, again, kill the bad stuff, but then in turn affects us. And so over time, we started understanding that there was a subset of people who were having this activation of their mast cells inappropriately or more than they should. And causing a variety of symptoms, which we should definitely cover and talk about. Mast cells contain over 200 known chemicals these mediators within them.
So it's more than just
the list is
histamine.
growing.
It's more than, simplistic to say it's just histamine, take an antihistamine, and you'll be fine.
Correct. And that's why that terminology of histamine intolerance is just not complete enough. Because histamine is just kind of a drop in the bucket. It's a much bigger problem.
Okay. So, for our audience out there who are wondering, I have these bewildering symptoms. Is it possible that some of my symptoms could be attributable to histamine intolerance? Could you give us, I know they are myriad symptoms, but give us some examples.
So, the thing about mast cells is that because they're our line of defense, they're found throughout the body in places where they are going to come in contact with the foreign things. So, they're in the upper respiratory tract, they're in the nose, they're in the eyes, they're in the mouth, because they're ready to attack whatever it's going to come in contact with it. So the symptoms, if the mast cells release their chemicals there, are going to be things like, the typical allergy type symptoms. As I mentioned, the runny eyes, watery eyes, the itchy lips, the itchy mouth. It could even be things like anaphylaxis. It could even be like the throat is closing and the system is shutting down. It could be that bad. So that's the sort of upper respiratory stuff. It's also found in abundance in the GI tract, the gastrointestinal tract, all the way from the mouth all the way down throughout. And so again, it's our line of defense. So if you eat something with a parasite or a virus, the mast cells are ready to attack. And that's a good thing. But again, if they're overreacting, then it's a bad thing, because now you're irritating the GI tract. And so we often see things like abdominal pain, irritable bowel syndrome. You can have constipation or diarrhea, and it can even affect the absorption of nutrients. They're also found in abundance in the skin, which is also in contact with our environment. And within the skin, you have things like hives and itching, and even some types of rashes, eczema, and things like that. So that
a little thing that I sometimes do when I'm examining a patient to, maybe elicit a diagnosis of histamine intolerance or MCAS is I take one of those tongue depressors, the wooden popsicle stick, and I run it across their forearm. And then I say, just wait for about a minute or two and let's see what pops up. It's actually a kid's game, because kids sometimes write on their arms. That's called dermatographia. And is that a possible sign of susceptibility to this?
Yeah, absolutely. And that is something that I always do with my patients to make the diagnosis. It's part of it, So you do see the redness, basically, of the line that you've drawn with the tongue depressor, and that's the release of histamine from the mast cells there. So skin is often a big component of the symptoms that patients with MCAS have. The other place that it's really in abundance is in the nervous system, which is interesting because we don't think of our nervous system as necessarily in contact with our environment. And our nervous system, our brain in particular, was always thought of being, I'll use the term sterile, meaning that there really weren't supposed to be any bugs or anything inside the brain. But we're starting to understand now that there's a new concept of something called the brain microbiome, which is that there are good bacteria in the brain doing something. They're trying to protect us. And so I always think if there's good stuff in the brain, there's probably the chance that you could get bad stuff in the brain. So the mast cells are there, ready to fight. But unfortunately, mast cells line all the nerves in the nervous system. And when they react, they will irritate the nerves. So you can see a variety of different neurologic symptoms, from anxiety, memory loss, headaches, pain, lightheadedness, dizziness, neuropathies, the gamut.
You just now included virtually 100% of our audience. Okay.
I know.
Clearly these are virtually universal symptoms that not always, but could raise the suspicion for some degree of MCAS or histamine intolerance.
I think that this is much more prevalent than we even can imagine. I know that when I started to become more in tune to the diagnosis and started diagnosing more and more people, it became clear that probably 90% of my patients have some aspect of it, some symptomatology associated with it. And so I think in the general population, we see it, we probably will see a lot of it. But for some people, it's tolerable. It's not, affecting their daily life. But unfortunately, in many patients who we see who are chronically ill, it is disruptive, and that's when it's a problem.
Indeed. What kind of tests can be done to ascertain whether a patient is suffering from this? Is there an objective metric that helps you decide whether a patient is a candidate for therapy?
Oh, absolutely. So there are some simple tests that can be done through a regular laboratory. And there are three in particular that can be done in any Quest, LabCorp, BioReference, whatever lab your doctor uses. The three include a histamine level, which is easy to get. And the thing about any of these markers that we're looking for, it could be negative even the first time you test it if the mast cells are not releasing the chemicals. We're measuring those chemicals, so histamine is one of them. So if your mast cells are not active that day, it might not look elevated, but it's still worth testing. But I just wanted to mention that it's worth testing this a few times to get the diagnosis. So we'll measure a histamine level. We'll measure something called the tryptase level. And the tryptase is another enzyme chemical that's found within the mast cells. And what we look for is actually, you usually have to test it a few times because we look for changes in tryptase levels from one time to the next. And it is always best to measure this when you think you're having a problem or reaction, because you'll see the higher levels. And usually a tryptase level, a moderate tryptase level, is something like 15 to 20. And then I want to go back to that in a second, because there's another diagnosis that you can make from the tryptase level that's worth mentioning. And then the other chemical that we measure is called a serum chromogranin A. And chromogranin A is just another chemical that's found within them. So those are three simple blood tests that can be done. I just want to go back to the tryptase for a second, because there is another diagnosis that's called mastocytosis.
Mm-hmm. Which is a recognized conventional disease. Yeah.
Yeah. And it is, sort of a subset of I'll call it a malignancy or type of cancer in a way, because mastocytosis means that there are too many mast cells. There's abundance of mast cells throughout the body.
It's like a leukemia of the mast cells. It's like a proliferation of that particular white blood cell line, as opposed to, lymphocytic leukemia, which would be lymphocytes going wild. So,
exactly.
Yeah. Actually, I'm not suggesting that I know that much about it. It's, you just explained it to me for the first time. I think I was taught this sometime 35 years ago, but you've just recalled it to my memory.
Yeah, that's the thing. We don't really think about some of these things as much, but now I'm clued into it, so I think about it quite a bit. But this mastocytosis diagnosis can have some of the same markers in the blood that could be positive, but the tryptase level tends to be much higher. And so if you have levels that are high enough to be flagged by the lab, that does warrant further testing to make sure that it's not that type of cancer form, the mastocytosis, because Mast Cell Activation Syndrome doesn't necessarily mean there's more mast cells. It just means that they're more reactive, and it's a syndrome as opposed to a disease. So I'd like to just wanted to make that distinguishing fact.
Mm-hmm. Yeah, those are the people who you'd refer to an immunologist, I guess, or
even a hematologist.
Hematologist,
yeah.
Oncologist, yeah. Well, you got to practice good medicine regardless, and not not minimize a problem and, suggest it's just a matter of taking a few vitamins or altering your diet when it's a serious medical condition. Okay,
exactly.
So these are the main tests that you can use. There are probably a few others that might point in that direction. So, what about pain? Can pain be related to this? Because there's some people with these very refractory pain syndromes, and I was intrigued to learn that mast cells may be related to pain.
Oh, yeah. Actually, now that the literature is exploding in this area, we now know that, and it's been published in the literature, that there's a mast cell associated disease specific pain syndromes is what it's called, and it includes different pain syndromes such as fibromyalgia, endometriosis, migraines, irritable bowel, neuropathic pain, post-op pain. Those have all been described as due to mast cell activation.
What about gynecological syndromes? Because I was intrigued that there seems to be an interplay between histamine and other of these chemical messengers and estrogen.
Yeah, well, so there are two parts to it. One is that we definitely see things like vulvodynia, which is pain in the vaginal and vulval area that many women suffer from. And the other part is that mast cells actually have receptors on their surface. They're estrogen receptors. So they react to estrogens and changes in hormones, and vice versa. They can affect the hormones as well. And so that's why they're probably, that's the association with the endometriosis. Premenstrual syndrome is likely associated as well.
And bladder problems, prostate
Correct.
problems, urological conditions?
Interstitial cystitis is a big one. And I've seen many cases of that actually, and treating. So what's really what I love about identifying mast cell activation syndrome for patients is that it just gives us another bunch of treatment options that we don't have. So if someone has something like bladder pain from interstitial cystitis, we have probably a few drugs that could work. We probably have a few supplements that you can try. We're always trying to get to the root cause, but what's fascinating is if you treat the mast cells and you try to stop the exploding, the activation of them, it can have such a big impact on these different disorders, including this interstitial cystitis, which I mentioned. So that's the point of doing the testing and making the diagnosis.
Indeed. Okay, and that's what we're going to do in part 2, is we're going to talk solutions and how to address MCAS, or sometimes simplistically called histamine intolerance. Our guest today, Dr. Tania Dempsey. Dr. Dempsey combines primary care treatment and integrative medicine at her clinic, the Armonk Integrative Medicine practice in Armonk, New York. And when we return, more on the subject of histamine intolerance. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.